Hey, good morning, Party Mill family. This is your boy Eric. I know I was supposed to hit y'all back yesterday with the causes of erectile dysfunction, but you're just not gonna believe the day that I had yesterday. Um, and it's amazing how this Facebook and Instagram keep up with you haven't posted in a while. I guess they follow your pattern and know when you should or that you post regularly. And because I didn't post yesterday, it sent me a message that I haven't shared anything in a while. So yeah, my apologies for not sharing on yesterday as promised. The causes of erectile dysfunction. So today, I will be sharing the causes of erectile dysfunction again during this Heart Health Awareness Month. So I talked about the erectile dysfunction, basically the pathophysiology of what are some of the presenting signs and symptoms of erectile dysfunction in men on Tuesday. So today we're going to talk about some of the causes, and we're just going to get right into it. So, uncontrolled chronic conditions such as high blood pressure, diabetes, having high cholesterol that are not controlled all contribute to erectile dysfunction. So when you think about the penis, again, the penis is basically a large blood vessel, okay? And an erection is blood flow, as I've said in the previous video. So to have an erection, you have to have good blood flow. So if there's anything that impedes that blood flow, for whatever reason it is, it will limit the ability to obtain and maintain an erection. And over time, just like sludge in a pipe, it's slowly like your drain. Just think about your drain at home. Over time, the hair and dead skin cells and all the different products that we put down that drain, what happens with that drain over time? When you first put it in, it drains like a boss. But after a while, you notice when you take that drain out, it don't drain as quickly, right? So that's what happens in the blood vessels. Again, keeping in mind that the penis is basically a large blood vessel. So anything that causes narrowing or clogging of that artery or those blood vessels is going to affect an erection. So high cholesterol, we already know that clogs the arteries. High blood pressure can cause the vessels to constrict, which leads to high pressure in the vascular system. Diabetes can cause a number of neurologic issues and also blood flow issues. Diabetes is a risk factor for heart disease today. Any injury or trauma to the pelvic area. Say, for instance, you were a man, you've had prostate cancer, and you've had to have radiation to the pelvis to cure your cancer. It could potentially affect the nerve endings, which again feed into the erectile dysfunction. And not per se the blood flow, but definitely the nerve endings can be irradiated or radiated by the treatment you may have gotten for prostate cancer, which again is going to involve radiation to the pelvis area. Any kind of major neurological condition, again, if you have spinal cord injury, that can affect your ability to obtain and maintain an erection. If you smoke, if you drink excessively, alcoholism, if you use illicit street drugs, cocaine specifically, it is a vasoconstrictor. Again, keep in mind, an erection is blood flow. The penis is basically a large blood vessel. So if you do anything that restricts, impedes the flow of blood to that area, it's going to be a problem. Men, if you have a large midsection and you don't have that six-pack like you did many years ago, that again impedes blood flow. It affects your hormone levels as well and can affect your ability to obtain and maintain an erection over time. This is a gradual process for most men. It doesn't happen overnight. Most men, again, like I said in the previous video, you will notice that it takes you a little bit longer to get stimulated to obtain that erection. And then you notice that you may not maintain that erection throughout the entire sexual encounter. And then you may not be able to get it at all, regardless. So then that's when you go to the doctor and you're asking for the Viagra, the Cialis, the Levitra. not understanding that that is a sign that you could potentially have some underlying vascular disease, because again, an erection is blood flow. The penis is basically a large blood vessel. And if that is not getting good blood flow, you're having problems with blood flow other places in your body as well. And you need to go see your doctor, be worked up, know what your risk factors are, which I will be talking about on the next video, the risk factors. So stay tuned of what you can do to help with preventing that from worsening. There are also some psychological impacts, again, that can affect erectile dysfunction that don't have a direct pathophysiological reason like I described with the blood flow and the nerve endings, but you could have major depression. You could have performance anxiety. If you have any kind of diagnosis on the mental health spectrum, it could potentially affect your ability to obtain and maintain an erection, which again plays a role in erectile dysfunction. So men, we don't like to talk about that anyway, and that is an issue we have to deal with on another day. But there are a number of common causes that we don't even think about that we can manage very easily if we would just see our doctor on a regular basis and have our annual physical, have our routine annual age-appropriate screenings done with blood work that can keep these things from happening, and then work on our health and wellness journey, which again is why Priority Meal is here. I'm here to help motivate you, educate you, help you navigate this wellness journey, and I'm working on a business that will provide those services to men in a very unique model. So stay tuned, y'all. But I hope I answered a lot of your questions about the causes of erectile dysfunction. One thing I did notice on the previous video, I didn't get that many hits, and I don't know why, because this is an issue I know men talk about. Well, we don't necessarily talk about it, but I know we are experiencing it. And it's interesting that video on erectile, the first video on erectile dysfunction, did not get a lot of hits, and I don't know why. And I actually think a lot more ladies watched it than men. And men, we just in denial. So I don't know, man. I don't know, but I'm still gonna keep coming at you, y'all. I'm sorry I didn't post as I promised on yesterday, but here we are today. The common causes of erectile dysfunction, and stay tuned. I will be sharing with you the risk factors for erectile dysfunction either tomorrow or the next day. But if you don't remember anything, y'all, remember, it's easier to stay well than it is to get well. Hashtag Priority Meal. All right, y'all. Peace. Have a good day.